Welcome to A to Z Medway channel. In this video we are gonna discuss about depression. What is depression, who all are affected by depression, how can we find and offer them help? From a survey taken, it is showing that 1 in 4 women and 1 in 10 men are suffering from depression. The ratio of female to male is 2:1. Factors affecting depression: family. If first-degree relatives have diagnosed with depression, twins, 40 to 50% for monozygotic twins, 20% for dizygotic twins. Physical illness such as Parkinson, epilepsy, Cushing syndrome. Some medications such as clonidine, theophylline, oral contraceptives. Some psychosocial factors that can cause depression are loss of loved ones, childhood physical and sexual abuse, financial loss, and unemployment. Depressed people have generally decreased level of neurotransmitters, such as serotonin, dopamine, noradrenaline, somatostatin, which is an inhibitory hormone, gamma-aminobutyric acid, thyroid hormone, and they have increased level of acetylcholine, adrenocorticotropic hormone, cortisol, and growth hormone. If we take a neuroimaging of a depressed patient, it shows ventricular enlargement, sulcal widening, and reduction in size, in frontal lobe, cerebellum, basal ganglia, hippocampus and amygdala. Symptoms. Symptoms can be remembered using a mnemonic, SIGI, CAP, where S for sad or low mood, I for lack of interest or anhedonia, G for feeling of guilt or worthlessness, E for low energy, C for lack of concentration, A for loss of appetite or loss of weight, P for psychomotor retardation or agitation, S for suicidal thoughts, S for sleeping disturbance, like insomnia or hypersomnia. According to DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5 or more symptoms, at least one symptom from first 2, that is either sad or anhedonia, must be there for 2 weeks to diagnose depression in a person. Subtypes of depression. In some patients, depression can be seen in associates with other features, like depression with psychotic features, psychotic depression. It is a combination of symptoms of depression and psychosis, such as hallucination and delusion. For example, patient with psychotic depression start hearing voices telling them negative about themselves, which is auditory hallucination and delusion of guilt. Then, depression with atypical features. In this type, the patient's mood can improve in response to positive events, short-lived. Such patients may feel better temporarily after having some fun time with their friends or family, then they come back to their original depressed mode. Apart from these, they will have some other symptoms like increased appetite, weight gain, heavy sensations in arms or legs. Depression with melancholic features. It is very severe kind of depression, usually seen in old age, high risk of suicide, excessive guilt, loss of pleasure, severe sadness, find it extremely difficult to get out of bed, loss of appetite are some of the symptoms of this type. Depression with catatonia. In this type, patient experiences symptoms of both depression and catatonia, state of immobility and unresponsiveness. Patient find it extreme difficulty in moving, speaking, or respond to stimuli. They will stay in one position for long period. With seasonal pattern. Associated with a particular season in a year with full remission during other seasons, to diagnose, at least there must be 2 major depressive episodes that correlates with a season in the last 2 years. Postpartum depression. Depressive symptoms during pregnancy or within 4 weeks of pregnancy. If symptoms occur during or after delivery, it is peripartum onset. Recurrent depressive disorder. It is characterized by multiple episodes of depression over time, persistent sadness, anhedonia, low mood and other symptoms of depression can be seen. Cyclothymia. It's a type of mood disorder. Patients may have periods of energetic and cheerful, hypermania, followed by periods of feeling sad or hopeless, mild depression. It is not severe like bipolar disorder, but can affect their daily life and relationships. Dysthymia. Also known as persistent depressive disorder. Low mood for at least 2 years in adults and 1 year in children is typical in this type. Premenstrual depressive disorder. Symptoms onset prior 1 week to the onset of menstruation. Low mood, breast tenderness, change in appetite, sleep difficulties, weight gain, muscular pain, bloating, can be seen during this time. Treatment. There are non-pharmacological and pharmacological approach to the patient. Non-pharmacological can be counseling, psychotherapy, such as cognitive behavioral therapy, interpersonal therapy. Pharmacological, giving antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, like fluoxetine, fluvoxamine, sertraline. These are first-line treatment for depression. Monoamine oxidase inhibitors, MAOIs. Tricyclics, but this should be avoided in suicidal patients, as it cause increased lethargy in overdose. If you like this video, don't forget to like, share and subscribe the channel for more informative videos like this.